Yeah, so I'll start. And I'm Corey Hallett. I'm a program officer with the National Cancer Institute. And I guess I'll let these guys, I'm going to start talking, but I'll let them introduce each other first.
I'm Stephanie Furtick, and I manage the small business programs at the National Institute of Neurological Disorders and Stroke.
And I'm Danny Gossett, a program officer in the National Institute of Diabetes, Digestive, and Kidney Diseases.
So we're going to give you some information on the SBIR program. And I apologize for looking down. I have a few notes here, so I'm going to try to keep on track so that I don't just run into what they're supposed to talk about. So I think all three of us represent three different institutes. We're happy to talk to people sort of more generally about SBIR at NIH and other programs at NIH for technology development and small businesses. I think one of the most important things is, when understanding the SBIR program and small business funding at NIH is just to remember that we are a mission-based organization, and really our mission is around, application of knowledge to lengthen life and help, disease, reduce illness and disease. So as far as the SBIR program, we're a congressionally mandated program. We are about 3.2% of the extramural budget at the NIH goes specifically to funding small businesses through the SBIR program. There is also a sister program that is usually administered side by side with SBIR. It's the STTR program, and that is also a congressionally mandated set aside at about 0.45%. So what that translates to in dollar amounts at NIH, in FY16, it was about $877 million. So, just under $900 million that are being funded or that are being spent to fund small businesses. Most of that is happening through grants. There are also, it also happens through R&D contracts. And I think someone's mentioning that. Is that not? Okay.
That's okay.
So what are the differences? So I mentioned the two programs, SBIR and STTR. They really are, most of the time when you talk to NIH, we will refer to it as SBIR. We're referring to both programs. But one of the critical things is that the SBIR program is really meant to fund small businesses that may or may not be associated with the university. And so there's a few sort of critical things there. And one is that the principal investigator who is associated with the project, their majority employment must be with the small business. So that program is meant for people who are really, employed by and engaged in the small business, rather than a faculty member who's a full-time academic and spending a small time with a small business. That falls more in the STTR program. So. Another sort of difference between SBIR and STTR is the association with a not-for-profit research institution. Oftentimes in STTR, it's the tech transfer program. It's the tech transfer program, I guess I'll say. And there must be a formal collaboration with a not-for-profit research organization, usually a university, and that is. The STTR program is where the small business is pulling technology out of the university. The PI may still be at the university, but the small business has a technology agreement with the university that they're going to take the product forward for commercialization. So the SBIR program, while a larger set aside, does have a lot more restrictions on how much work can flow back to the university. So it's important, if you're thinking about applying to the SBIR program, to think about, to look at those two programs and think about, where the specifics for your business fall. If you are doing a lot of work with a university, then you really need to consider the STTR program. Overall, so this is a government-wide program. I mentioned that the SBIR program at NIH is just under $900 million. DOD is slightly bigger. DOD was just under $1.1 billion. their program is a little bit different. They do operate mostly through R&D contracts, whereas NIH, we operate mostly through grants. So grants are investigator initiated. They're a lot more, I don't want to say relaxed or, manipulated, but you have specific aims, you have a general sort of direction you're taking the project, whereas the R&D contracts are a lot more defined, right? It's really they're looking for specific technologies. I guess one last thing is just some of the benefits of the SBIR program. It really is one of the largest sources of early or seed stage funding for small businesses in the country. And it is non-dilutive capital. It's not a loan, right? It's grants. And that the IP rights are retained by the small business. The government's not taking the IP, and I think that's really important. The IP stays with the small business. So it also, especially since we're here at Resi and there's a lot of investors and a lot of small businesses talking to investors, I think one of the things we hear a lot is that it can be beneficial for people to know that a technology has gone through sort of the rigorous scientific peer review process of the NIH. So there is that component that a panel of scientists who are usually sort of key opinion leaders have looked at a technology and scored it well enough to get funded. And it is a competitive program. So that is sort of an important caveat to the SBIR program. From there, I'm actually going to turn it over to Stephanie. She'll give you more nuts and bolts about it.
Well, and I want to make sure that there's plenty of time for questions and more discussion, because as I'm sure as interesting as we are, that's probably where some of the more interesting conversations will occur. But so the SBIR program is a phased program, and it's been around for a really long time. So part of the other things we want to do here is we want to do a little what I affectionately call myth busting. But I have heard I've been with the NIH for about 14 years now, and I have heard a lot of misconceptions about the small business program because it's been around for a really long time, and it has changed since the 80s. Really has. But it's still a phased program. So there's a phase 1, which is a feasibility study, phase 2, further research and development, and then the phase 3 is commercialization, which is non-SBIR. So we expect that people will commercialize in the phase 3. Now, those definitions are really broad. So I get people who come to me and say, what is feasibility? What is feasibility? I have seen people do in their phase 1 as a feasibility study in vitro work, phase 1 as a feasibility study animal work. I have phase 1 people doing a phase 1 as a clinical trial. So there are a variety of different things that people can do in a phase 1. Phase 2, further research and development. I think that's a fairly flexible term. And then, commercialization may be a company taking that and actually getting additional money from a third-party funder and then going off and doing a clinical trial. So we don't get too caught up in, if this is or is not feasibility. You can actually talk to us, and we'll be happy to kind of talk you through what we see as feasibility and what's kind of a nice go, no-go point between a phase 1 and a phase 2. We also do something called a fast track, which is the phase 1 and phase 2 in one application, so you don't have to come back through our review process. And I hear a lot of misconceptions about the fast track. One of them I heard actually today was that it's harder to get a fast track than a phase 1. Actually, that's not true. If you look at our specific percentages, the percentages for a phase 1 in 2016 hovered between, somewhere around 13%, and for a fast track, it was somewhere around 14%, virtually identical. So, I think that, it depends. If you are ready for a fast track, that could make sense. The other big thing that I hear a lot is the questions about budget. So I'm going to dispel that right now, too. So there are a number of, you'll see a budget guideline of 150 for a phase 1. That's a guideline. That is not a hard cap. We easily go up to $225,000 for a phase 1. and 1.5 for a phase 2. However, NIH has received a waiver to exceed those amounts. So those are congressionally mandated caps, but we can exceed those caps for specific kinds of programs, such as if you're using vertebrate animals or human subjects. A lot of what we do uses vertebrate animals and human subjects. And each institute is a little bit different with their guidelines. I can tell you at NINDS, we are very flexible. And we offer, longer phase 1s. We offer phase 1s that can be up to 2 years. I know NCI tends to do 1 year, and I think NIDDK tends to do 1 year. And then for phase 2, they can be up to 3 years. And again, the budget is more flexible, and there may be even some programs that allow even a larger budget than in the standard solicitation. So I think if you have a question as to whether or not your project might fit, don't immediately look at it and say, oh, well, the budget's too small. Actually ask, because it might be reasonable for what you're trying to propose, depending upon the institute that you're coming to. There's a lot of specific eligibility criteria. I'm not going to go into it now. Suffice to say, we can help you walk through it. It is online. It involves the big sticking point for a lot of people is ownership, who owns the company. And so I'm not going to go into that, as I said, but I do, it's something, definitely look at it. If you have questions about it, I think we're happy to answer those questions. So one of the myths that we often see is people say, oh, well, I want to submit to a specific institute. You're actually submitting to the NIH as a whole. And your application then gets assigned to a specific institute based on the scientific content. And I think that's a really important point because, it's each institute and center has their own specific policies and guidelines. And so it's really important to kind of have an idea of where you're likely to be assigned, but it doesn't hurt to put several institutes down, and we'll get into that in a bit, but it is important to know that you're submitting to the entire NIH, but it's important to contact us ahead of time because each of us have our own guidelines. As I just looked over and said, okay, for budgets, how long do you guys do phase 1s? I mean, we're all a little bit different. I think in the neurosciences, we tend to be a little bit more flexible because that road tends to be a little long. Another myth is that just because somebody has a low budget means that they have a low success rate. Definitely not true. And in fact, the SBIR and STTR is a great example. So a lot of people might have heard Corey's comments and said, okay, well, the SBIR has more money, therefore it must be easier to get an SBIR. But if you look at the success rates year after year, they're actually virtually identical. Why? Because we get far fewer applications to the STTR. So a lot of those smaller parts of our organization, a lot of the smaller components of the NIH are actually a great place to go. And sometimes people try to tailor their application to fit, say, NCI, because NCI's got the most money, when in actual fact, they would have been much better off sticking with what they originally wanted to propose. It might go to an institute that's smaller, but in actual fact, they get far fewer applications, and they really want good quality applications, and they're looking for those good projects. So don't assume just because somebody has a small budget that they can't, that it's harder to get. And that's definitely exemplified, as I said, the great example of that is SBIR versus STTR. And it depends on the institute, and it depends on the year. Some years it's better to be an SBIR, some years it's better to be an STTR. I tell people, pick which one makes the most sense. It's gonna make more sense in review anyway. As was noted, we focus on investigator-initiated research. So another thing I hear a lot is, you don't have a specific program announcement for me. At our institute, you probably won't see one, actually. We have 300 to 400 different diseases. We will not have a program announcement for each disease. I'm not writing that many program announcements. But what I will tell you is we are really big into the general solicitation. We tend to do general solicitations. We tend to do, here's a solicitation for clinical trials. Here's a solicitation for small molecule development. We tend to do these broad, overarching program announcements based on stage. But each institute is different, but the majority of us do, stand behind the general parent program announcement. There's also a contract solicitation. The due date for that is October 2nd. So if you are interested in the contract solicitation, NINDS does not do any contracts. NCI does a lot of contracts.
We don't.
NIDDK doesn't do any. So you can see there is a little bit of a difference there. But there are specific program announcements that you can be, that are out there. And one of the other points of confusion that I hear is that the SBIR program is a set aside. But often we will have program announcements that have an SBIR version and a non-SBIR version. That's so that we can take, you as a small business can take advantage of that set aside and still be part of that program, which may have resources connected to it or other, kind of benefits. And that basically gives you the advantage of the best of both worlds. You get to take advantage of the set aside and get the resources associated with that contract. So for example, we have the Blueprint Neurotherapeutics Network at NINDS that supports small molecule development. There's an SBIR version of that, so you get to take advantage of the SBIR set aside and get the access to the CROs and the consultants that you would get since you're part of the Blueprint Network. So don't, people think, I've got to be either SBIR or one of these programs. Actually, you'd be both in that situation, which is the best of both worlds. So, but the important thing here, and what I'm going to end with before passing off to Danny, is contacting us ahead of time is really important because we can help you navigate it. I recognize this can be very confusing, and that's why we're here. We're here to help navigate that process.
Yep, and we all work together. So if you come in the door through NIDDK and your application might not be relevant to us, we'll refer you over to somebody who might be expert in that domain. And related to the funding opportunities, at the bottom of every funding opportunity, there are scientific research contacts, and that should be your first entree into the NIH for that funding opportunity, to make sure that that your work would be responsive to it. So program officers can be project managers, program directors. We're all program officers, more or less. We're the scientific liaison to the government. We advise that you contact us at least a month before you apply. We have 3 standard receipt dates. Sometimes at particular funding opportunities will have specific receipt dates, but in general, those are September 5th, January 5th, and April 5th. And in the month before those dates, we're inundated with communication, so it's really important to get on our calendars a little bit before then. So you can find the program officers either in the funding opportunity, you can visit the websites of the various institutes. Another great resource is called NIH Reporter. You can Google that. It's our database of funded applications. You can get a lot of information there. You don't get the full application, but you get the abstract, you get the assigned program officer, the information about the grantee, how much money, how long the project was, and I think in the future it will have some outcomes. Mm-hmm. But that's a great way to find out what institutes are funding similar research. So you paste in an abstract and see what you get. When you first contact a program officer, it might be useful to copy in a project summary, or if you've written specific aims, 1 page, those will be helpful for referring your application and helping your program officer do some research before you talk. So we covered reporter. So there are many different people that you'll talk to along the way through the application process. The program officer is probably the first and last person that you'll talk to. So when you come up with an idea and you write your project summary, you contact the program officer. Before putting in an application, you may have some interactions with the Small Business Administration when you're looking into whether you're eligible for the program. When you're applying, there's the ERA service desk. These people will help you navigate the application process through either Assist is our new application system, or grants.gov. ERA will only help you with Assist, so that might be a good first approach. Once your application is in the system, it will go to the Center for Scientific Review's Division of Receipt and Referral. These people are trained PhDs, will route your application to appropriate institutes and appropriate study sections. And if you have questions about where your application is referred, you might talk to them to get clarification or reassignment. It will go to peer review, and during that stage, the scientific research officer is who's managing the review, who's recruiting the reviewers, and who's overseeing that review. And if you have questions about the study section, it's sometimes helpful to talk to the SRO to make sure your application is a good fit for that study section. After the review, within a month, you'll get a summary statement. That's the summary of the review, both the written comments and a summary of the discussion, if there was a discussion. And in the upper left-hand corner of the first page will be a program officer that's assigned to that application. And oftentimes that program officer has listened to the review and will have additional insights into the tenor of the discussion beyond what was transcribed in the summary statement. So after you get that summary statement, email your program officer and set up a time to discuss. They'll also potentially give you some insights as to the likelihood of funding. You can get some idea of that for some institutes who publish pay lines, which is the cutoff below which they pay applications. But the program officer will have additional insights and will help you talk through resubmission. I'm going to backtrack 1 minute. So there used to be something called the cover letter, where you would describe in some detail what you think is needed to review your application. Now there's a specific PHS assignment request form upon which you can indicate potential institutes and centers, NIDDK, NCI, NINDS. You can indicate potential study sections if you're aware of a study section that might be especially equipped to handle your application. Or if you don't know, you can list specific details about the project that are necessary. I need a bioengineer to review my application. It's not going to go over well if just nephrologists look at it. So those are details that are helpful to the SRO when they're recruiting reviewers in from industry and academia to review your application. And you can also indicate potential conflicts.
And the conflicts are critical because if you're a small business and you know you have a direct competitor, you can list that direct competitor on this form. If, however, you want a specific person to review your application, that's not a good idea. If anybody you list on that application is going to be in conflict, anybody you list in there is going to be considered in conflict. But that specific expertise is what's really important. Hey, I need a neuroscientist, or I need a neural engineer, or I need whatever. But definitely those conflicts, a lot of people don't realize they can put conflicts down. If you know there's a company that's in direct conflict with you, put the company down.
And Stephanie mentioned that the acceptance rates or the funding rate for applications is somewhere around 13 to 14%. So most people are resubmitting or not getting funded, and therefore should consider resubmission. Or success rates do tend to improve upon resubmission. It's not always the case. You might get a worse score. You might have an undiscussed application, but oftentimes scores do improve. You have an extra page to respond to reviewer comments in your application, and you have the benefit of reading what the reviewers have said about your application and talking to the program officer after the fact. I think that's...
And then just our website, is sbir.nih.gov, and that is a wealth of information, including sample applications. A lot of people, particularly if they're new to the process, there's a number of registrations you need in order to submit. There's a number. I always say, we don't take a piece of your company, we won't make you pay it back, but there are forms to fill out. This is the federal government, and so you do have to fill out the forms and do all the registrations. So that's what we take from you, is some time. So I think we want to open it up to questions.
Yeah. No, I mean, we can open it up to questions. Yeah.
So is one better to apply to a specific funding opportunity announcement or some broad global announcement? Because on the broad one, they're going to decide at NIH what's the best place, and the other one, it's fairly specific and you're limited, right?
Well,
Not always, sometimes. Yeah. So I would encourage you to think more about which institute you want to apply to and look at how they solicit applications. So at NCI, almost all of our grant applications we receive through the omnibus solicitation. Like any NINDS, we really don't put out very many technology-specific funding announcements for grants. Almost all of our technology-specific funding announcements come in the form of R&D contracts. But you can use that assignment request form, even if you're applying to the omnibus, to say, well, I think this is the appropriate institute for my application, and it'll get routed there.
Or institutes. It
Yeah,
actually
I
doesn't
agree.
hurt to put in a couple, because sometimes, particularly at the end of the fiscal year, we may look for co-funding. We may have, I may have a little money left over. Annie may have a little money left over. We'll combine forces to fund one last application. And I would say, you start with the, what is it that you want to do? Okay, which institute does that fall under? And then what are their options? And again, for us included, the vast majority of ours go through the omnibus solicitation. And if you look at a lot of the program announcements, if it's a PA, if it's a special program announcement, say we put something out there, if it says PA and then it has a dash and has a number, there's no review, special review, there's no special set aside associated with that program announcement. And in fact, a lot of program announcements go to CSR, just like all the other program announcements, get reviewed by the same study sections. They may have one or two things in the review criteria, but unless it's a PAS or an RFA, it does not have a special set aside, even if it's a special program announcement. And we do very few PASs or RFAs through the SBR program, because the SBR program is already a set aside. So we don't generally do set asides of the set aside.
I would say for the R&D contracts, though, one of the reasons NCI
Contracts are separate.
Contracts are separate, but you do have sort of special emphasis review, and that is done at the institute level rather than the NIH
And
level.
some programs do have special, so that
Yeah.
Blueprint program, as I was saying, has a special review. So I think and this is where it's important to contact us and say, hey, is there a difference between coming in here and here? Because we'll be able to tell you, actually, sort of the same.
Yeah, so there was another.
Two questions actually. My first one is, of the 13 to 14% of applications that get funded, at what stage are you looking to invest in? Is it really early where it's just an idea, or is a proof of concept has been developed, and what's kind of the general breakdown? And then my second question was, for the different phases, phase 1, 2, 3, can you just expand a little more on what's go and what's no go for those phases once you're funded?
Oh, and I feel, because the answer is, what stages do we fund? Yes. I mean, I fund everything from I'm developing a prototype all the way up to I'm doing a phase 2 multi-center clinical trial. Yes.
You will need some preliminary data in order to be competitive, right? You don't need any preliminary data to apply. I mean, there's not a requirement for it, but to be competitive, you'll need something coming in the door. It can be this is where it can be really helpful to contact your program officer if you're new to the program, and talk to them, or contact a program officer and talk to them about, this is what I have in hand, this is what I want to do, is this realistic? Because like Stephanie said, it's all over the map, and there's a lot of factors that go into it, right? So maybe you're in a really crowded space. You probably have a higher bar to be competitive in peer review if you're in a crowded space. Maybe you're in addressing a huge unmet need, and your technology has a lot of potential, and people get really excited about it, but you don't have as much preliminary data. That might still stand a good chance. We obviously we're not making the decision, right? Everything goes through scientific peer review. But we can tell you, we've seen other things in the space, and peer reviewers generally want to see this. I mean, we can sometimes give you some guidelines.
Yeah, we have guidelines, but it's really up to the applicant to demonstrate what stage they're at. And I mean, we have the budget and timeline guidelines, which can sort of provide some starting point. We have funding opportunities that we target to our academic investigators. So if we're talking about drugs, for example, we have funding opportunities for assay development, high throughput screening, and some preclinical development. But we expect, we have another solicitation that is for lead optimization and additional preclinical development toward an IND, and that we encourage small businesses to come in for. So that's a ballpark, but really you can justify coming in earlier or later with an SBIR.
Which drives in a lot of ways, that's what I find is extremely, people really like about the program is it's very flexible, and they also find it very frustrating because there isn't a really set, this is phase 1 means this, phase 2 means that. It's actually kind of, I see it as a, well, why don't you tell me where you're at, and I'll tell you how the program can potentially be used for you. And it's a little bit of a, and again, we may have specific programs that have specific entry criteria, but overall the program is very flexible.
And in terms of phase 1, phase 2, and phase 3, I think it's helpful to think about phase 1 as a critical technical hurdle that you're trying to overcome. Mm-hmm. And if you you define quantitative milestones, and if you meet those, then that motivates applying for phase 2. Or if it's a fast track application, those quantitative milestones are used for us to justify advancing you to phase 2 administratively.
Can you speak to accessing these funding programs for companies outside of the U.S. and maybe whether or not the research is taking place in the U.S. or not?
It's very difficult for us to spend money outside the country. We definitely cannot make awards to companies that are, or small businesses that are based outside the U.S. If there's a unique resource at a contractor, they have a specific animal model that has not been imported into the U.S., we can sometimes justify that subcontract or contract to a foreign component of an application, but that's very uncommon in the SBIR program.
I would go a little bit further and say if it is going to take so long to get the approval to use money outside of the U.S., even if you have that special resource, that it's worth talking to your program officer about how to do it where all the SBIR funds are being spent in the United States. It's not that it can't be done, but it is going to just be a long and onerous process to get the approval, at least at NCI. I don't know about the other institutes.
It's a process.
Yeah, but
the bar is high.
What we've seen is, and it's still rare, and it still kind of takes special approval, but we've seen people who are doing clinical studies outside the United States because that's where the patient population is. Maybe the patient population really isn't found in the United States in high numbers, but they've done all of their manufacturing in the United States, and so they've spent all their SBIR funds on those U.S.-based activities. And then they've shifted to foreign sites, and then the foreign study was conducted with other funds. So sometimes it just kind of takes that creative approach.
But as part of the eligibility criteria, though, you do need to be a U.S. company based in the United States. 51% owned by individuals who are either U.S. citizens or permanent resident aliens.
Yeah, and in the back there was a question.
I think she was just giving us 15 minutes.
Did you have
any other questions?
Well,
Yep.
I'll ask a question. Talk a little bit more about what you actually mean by commercialization or support commercialization. Well, what falls into that category? What doesn't fall?
phase 3, or how do we define
What do we see as commercialization?
That you would support and not support.
Is there a product or a service? Are you as a company, doing it? It has to be some kind of. So when people come to me and say, "Hey, is this part of the SBIR program?" My comment is there a product at the end of the day, or is there a service a service model that you can support using this research? So we support everything from therapeutics are easy. Everybody kind of sees, it's a therapeutic, and there's kind of a model for selling that. We also support development of research tools. You're going to develop that research tool and you're going to sell it to researchers. That's a model. You'll make money. So I think we're pretty flexible as to commercialization. Now, you don't need to be at the point of commercialization at the end of the phase 2. Particularly for therapeutics, that may be very unreasonable. So what we expect is that you will hit some kind of inflection point that either makes you attractive to third-party investors, or there has to be some next step that you will be able to carry it the rest of the way, because we'll only be able to carry it a certain amount. Now, we do have some of the institutes and us, and actually all the three of us up here, have what we call a phase 2B program, that once you get to the end of your phase 2, if you're still not quite at the point where you have that inflection point, will provide additional, basically it's like an additional phase 2 to help carry you the rest of the way. And that can support clinical research, it can support IND enabling studies, it can support a number of different factors. If you're a research tool kind of assembling something and doing, making sure that it's at more of a final product. So getting that additional funding to get to the point where, again, you're at some inflection point. So I think we recognize that a lot of our stuff requires, phase 3 clinical trials. We don't support phase 3 clinical trials with the small business program. So we recognize that you might not be at the point of selling something, but you should be well on your way of getting to either, investment or some kind of transition.
Some of your question may come from, maybe we might be looking at it from two different perspectives, because at NIH, the vast majority of our extramural budget goes to basic research, which we wouldn't consider anything on a path of commercialization. It's not product driven, it's science knowledge driven. And so for us, we sort of say it has to be on a path to commercialization in saying you have an identified product and you're trying to develop that product in a rational way that would make sense you're trying to move it forward to the market as a way to differentiate from what a lot of NIH funds. And so maybe that helps, just giving our perspective a little bit.
Any other questions?
I would say one other thing, which is we provide a lot of money. That is what we do the most. But there are also other opportunities once you're in the SBIR program. We have I-Core, which is a technology development program trying to help sort of refine, identify your value proposition and sort of refine your development path for what the market really wants. We also have an investor initiatives program. So all of our institutes have companies that are in our portfolios that we've paid to come here to RESI to help secure private capital in some way or start pitching their technology. So there are other parts of the program also. So once you're funded, talk to your program officer, keep communication open, talk to them about where you are, what we can offer.
I'm always
NINDS
amazed.
does a lot too.
Yeah. I mean, I'm always amazed at the number I'll send out. Hey, there's this free opportunity. All you have to do is sign up, and people don't get back to me. I'm thinking, we're willing to send you somewhere. So I think there are these opportunities that do come up that even if you're funded and once you're funded that are beyond the money, that hopefully will help people again get to that transition point and get to the point of either additional funds or commercialization.
We also, at NCI at least, we try to have a network of people, of potential investors, right? And they can come to us as a resource for deal flow in their specific technology area. You can talk to us, you can look on Reporter, because that's all public, and so you can look for things, in your area. But then you can contact us and say, hey, we think that there are a couple companies in your portfolio that we would be interested in talking to. We will get a public slide deck, or we'll let them know there's someone interested and ask them if they would like to provide a public slide deck to us and then pass that on to you. I mean, we try to build these relationships to help, because we know we're not giving companies enough money to get their product from very early stage of development to a really late stage of development, or some sort of marketed product. I mean, we're just not giving that much money, and so they're probably going to need to get private capital at some point. So we try to help that happen.
Mm-hmm. Yes.
Can you talk a little bit about resubmissions? It's been confusing about what a resubmission is. I've heard there are no resubmissions, you just apply again. I've also heard there are formal resubmissions with comments about the reviewers.
There is a formal resubmission process. So it is you submit and say you don't end up getting funded, but you have the reviewer comments. You can then resubmit. You get 1-page introduction to review, where you can talk about what you've changed in the proposal, kind of point people to what in your application has changed and how you've tried to address those concerns. And then that's a resubmission. Now, say for whatever reason you just miss getting funded again, then you can submit a new application and start the process over again. So it used to be that we only allowed you to submit the same proposal twice. So I called it the 2 shots on goal. Now we actually allow you to retool it and resubmit it, but it would be considered a new application. But you do get one resubmission where you can address those reviewers' concerns. And regardless of if you get an overall score and are discussed, because we only discuss and score about 50% of our applications, but every application is reviewed, every application gets reviewer comments. So it gets assigned to 3 reviewers. Those 3 reviewers kind of determine if it's in the top half or bottom half of the applications in that study section, and then the top half get a score and get discussed. And the bottom half get the reviewer comments and can resubmit. And I've also heard people say, well, I didn't get discussed, so I shouldn't even bother resubmitting. Look at the comments. Actually, talk to us first. It might, if you were, we discussed the top 50%. What if you're 51, right? And the comments will reflect that. So we'd rather have you talk to us and see, hey, actually, they just really hated specific aim 3. Drop specific aim 3, and you'll be in a much better position. Not always, and sometimes you really do need to really rethink the proposal, but it's worth it to have that conversation. I mean, that's why our contact information is on the summary statements, because we're here to kind of, we do go to the reviews, we're here to talk you through and kind of think about the comments that are there. And collectively, we've read, I don't know, hundreds of summary statements. So many summary statements.
Stephanie has read hundreds of summary statements along. I can guarantee you that.
So, I'm really used to seeing it. We go to these study sections, we understand what, their culture is, what they tend to be concerned about the most, and we can help you understand that. Yep.
What are the top 3 biggest mistakes people make?
Ooh.
Each of you.
So not having clear go, no-go criteria between the phase 1 and phase 2. You should have clear go, no-go milestones that you're trying to hit between phase 1 and phase 2. Not having someone else read their application. In a small business in particular, you're eating, sleeping, and breathing the application, and so you may be assuming things. The people who are going to be reading it have not been eating, sleeping, and breathing your application for the last 5 years. And your technology for the last 5 years. So really having someone outside of your company read the application. I always joke, find the most critical person that you know, give them a red pen, tell them to go to town, because that's how you communicate with reviewers, is through that application. So I think the big mistake is, and then the other thing is rushing. I can't tell you how many times people said, oh yeah, that wasn't clear in the application. I really shouldn't have probably, I tried to hit this receipt date and I rushed. And you lose more time that way, because then you've got to go back and resubmit, and it just takes more time. Submit the best possible application that you can. It will be shorter in the long term if you do that.
And I kind of cheat and add on to that last one. Not recognizing the importance of the specific aims page. And I think that's something that happens a lot when you're rushing. So that's kind of how I'm adding on. The specific aims page is really the executive summary of a grant. So oftentimes people will turn to the specific aims page first. They will get as much information as they can from that page, and then they'll backfill with the rest of the application, the knowledge that they need. And when you're in peer review, so you'll have 3 primary reviewers that will have scored it ahead of time. They're whose comments you get on the summary statement. But the entire panel is going to vote on your application, and that's what's ultimately going to give you, as long as you're discussed, and that's what's going to give you your score. That whole panel probably didn't read your application. They're going to listen to what those 3 people said, and they're going to read your specific aims page, and only your specific aims page. That is it. Some of our most successful awardees have said they spend a month on their specific aims page. I mean, it really is a critical page. The second thing I would say is not being completely clear how what you're proposing is critical for your technology development. We have a lot of people who come in and they kind of say, well, I'm going to combine this with a checkpoint inhibitor, right? Because that's what everybody does right now. And so, but it's not clear why that's critical for your, if it works or doesn't work, is it going to change your potential commercializability of your product? I mean, you need to have strong rationale for why what you're proposing is critical. Do I have to do a third? No.
Okay, thanks. I think another area is not having the right expertise on your project at a significant enough level. So you might have a contractor who has your domain expertise. You might be the chemist or the biologist, but you don't have the clinician at a significant enough effort, considering thinking about how they're engaged in the project throughout its lifetime, both in proposal development and how they're going to inform the next phase beyond the grant. I had something else. It will come to me.
I think the disease expertise, I'll talk for a minute while you're thinking, so before we close out, but I think, the disease expertise is really important, and I see this a lot particularly with engineering grants, where they have the engineer and that person's really leading the project, but they don't have the disease expertise, and so they come to us, and the reviewers can tell, because the disease expertise will be on the review, and they can tell just based on the terminology you're using in the application whether or not your disease expert has read your application and really bought in. So if you have an expert on board, say, not including that expert in the actual application process, I would say is critical. Make sure that disease expert has really read that application and given their feedback, and make sure it sounds like a disease expert has read that application and given feedback. That's really important, because they're going to see, are they really incorporated as a team, or is it just an add-on?
Yeah. There's.
How important are letters of support?
So, very. And this is something I hear a lot from academics. They say, well, letters of support are just fluff. But no, in SBIR, they're very important. And they can really help bring validation to your technology's market potential. If you have someone who really understands the market, who is not already key personnel on the project, who is willing to say, hey, we think this is a really good idea. We think the market's really going to benefit from this if it works out. Or have, pharma, or I'm obviously a therapeutics person because I keep having therapeutics examples, but, come write a letter saying, we're watching this technology. That can be really powerful too. I mean, it really lends validation to the need for the technology.
Mm-hmm. So I think, and definitely anybody who's a collaborator or a key individual on your application needs to have a letter of support, and do not make them all the same. Do not put a form letter in there. They do not like form letters. I've literally had people say, well, I just had everybody sign the same letter, and he was like, how invested are these people? They can't even write the letter. Not a good sign.
Clinicians can also be really powerful letters of support, assuming they're not already associated with the project in some way, because then it's obviously it's good.
I mean, it's good, but then they're willing to be part of it.
Yeah,
patients. Anything else? I'm sure we have like 1 minute left, or we are out of time. So that was easy.
We have a table, and we're also floating around. So.
Right. Yeah. Absolutely. So please feel free to come up and talk with us. And thank you guys very much.